Hi, everyone. So I couldn't be there in person, and I hope you have a wonderful day and a wonderful meeting, and I'm looking forward to seeing you next time. I'm Kathryn, Akeah, consultant for the commission, and today Heather and I are here to talk to you about behavioral health crisis response projects. So with that, I'll turn it over to Heather.
Hi, everyone. I too am sorry that I cannot be there in person and looking forward to seeing you all again in the future. I'm Heather Erb. I'm with the American Indian Health Commission, and I work on legal and policy issues for the commission. So we've been up to a lot lately in this particular area. We have had regular meetings working on different documents. So one of the bigger documents we're working on are the Tribal Crisis Coordination Protocols, formerly known as the 701 plan, just the behavioral health piece of the 701 plan. We have also been working on policies for tribes that tribes could use to stand up their own designated tribal crisis responders. We've been continuing our work on doing a template tribal behavioral health code, and also creating new processes for improving notification between providers, police, and hospitals. And Kathryn, did you want to speak about the 988?
Sure. So 988, it will be implemented, we'll be going live this summer. And part of that has been, there have been several projects related to that. And supporting the Tribal Centric Behavioral Health Advisory Board, we have been working on projects such as feedback for the first round of the statewide initial assessment on crisis response. And there will be another one of those. Well, the first one, the initial one was due in January 2022, and the next one will be due at the end of the year. So we're trying to make sure that tribes are included in that system assessment. And then the second piece of that is on 988 implementation itself, the technical and operations plan, really looking at all the pieces behind the scenes, data sharing agreements, how the data systems will talk to each other, that sort of thing. And we're making sure to get some comments and feedback on that. And there's a whole the whole series of roundtables and then consultation later this summer. So there's a whole set of dates, and if anybody wants to know for more information or get invites to those dates, you can always let me know. We can forward you some of the emails. Thanks.
And the next slides, we have pretty dense information, and we won't go into detail about it, but wanted to make sure you had some references for some of the key concepts that we've been focusing on with others, including other tribal attorneys, tribal staff, healthcare authority staff, et cetera, in our work with the protocols. And first and foremost, that's clarifying roles and responsibilities of all the entities that interact with Indian healthcare providers and tribal members. So whether it's evaluation and treatment facilities, managed care entities, in the DCRs, et cetera, knowing who's responsible for what and what happens when things go wrong. How can tribes find a process for corrective action? How can we make sure corrective action is enforced when these entities fail to follow protocols or best practices? And making sure that all these recent protections that we've had passed in state law, the RCWs and WACs, that have American Indian Alaska Native protections in them are in the protocols as well. And this is just a sample from the protocols for you to look at later, but again, really delineating between DCRs having access to land, coming onto tribal land, but also exercising authority on tribal land, that is ultimately the decision of the tribe, and to make sure that's very clear in the protocols what the tribe has decided as far as access to their land and the exercise of authority on their land when it comes to somebody experiencing a crisis. And there's just another example of a particular part of the protocol in where a tribe can select which options they choose. And these are citations, as I mentioned earlier, to RCWs that have their, some of the newer protections for American Indians, Alaska Natives, and Indian healthcare providers to ensure that they get notice when a tribal member or one of their patients is in crisis. Now this is legally required of DCRs. We want to make sure that's being appropriately complied with. And so we've laid that out here for your review. So those are some of the key highlights on some of the things that we're working on, and we encourage you to reach out to us at any time with some questions, input. If you want copies of the documents, be able to look those over and see where we are. And we always like to have more people, tribal attorneys and staff to provide us their input. Kathryn, was there anything else that you wanted to add?
I think that's a good recap for now, and we look forward to giving you the next recap too as all of these projects move forward. So thank you.
Thanks, everyone.